Assalamu alaikum. My name is Vira Habib, and my today's topic is inspection of the respiratory system. First, I will tell you our respiratory system consists of lung, nasal cavity, pharynx, trachea, lungs, bronchi, and the diaphragm. Why we take history? Because we take history to determine the scope and the intensity of the chest examination. The physical examination of thorax must be expanded beyond the minimum screening examination to determine the nature of the problem so that the diagnosis can be made. The technique we used in the respiratory system examination is first we have a comfortable environment for both you and your patient. Then the physical examination begins with the first step, that is the history taking. Then you notice the symptoms when the patient comes into your room, or and then when he's comfortable, start the physical examination. With the respiratory system examination consists of inspection, palpation, percussion, or the escalation. And now I'm telling you what is inspection. The inspection begins through the active observation. One, one should note the dynamics of the patient's facial expression when he's talking or when he's inspiring or exhaling. Observe the use of the pursed lips during the expiration and the activity of the sternomastoid muscles. Because when he is having problem, or there is a when you note the development of sternomastoid muscle, there is a problem. First, one should observe the thoracic age of deformity. If there is a deformity like kyphosis, surgical, or the traumatic scars. Non-manually elected data. Non-manually elected data which you can't see but you can hear. That is sounds like wheezing. There must be a problem while exhaling or inhaling. Even more useful information can be obtained as the patient breathes both quickly and deeply. Now I'm telling you what is palpation. Place the entire palm. How to take palpation? You have to place the entire palm of each hand on the superior portion of the both hemothorax and then gently move through the femur and move the hand inferiorly to just a bit below the 12th rib. Repeat the process moving laterally and subsequently anteriorly. Research for the rib deformities, nodules, and the areas of tenderness. Palpate the area with increased firmness and in attempt to allege the tenderness and to assess the maneuver reproduce the patient's symptoms. One and there is in continuing the palpation process. This is done by the examined patient posteriorly. You have to check the posterior portion of the patient too, because the examiner thumbs together at the midline. Here's in the photo you can see the examine the patient posteriorly, placing the examiner thumb together in the midline at the level in the 10th rib and the hands grasping the rib lateral quadrant. In the image C you can see that. And then with the lateral thumb typically separate the approximately 2 to 3 centimeter. In the diagram D you can see that. Palpating the interior inferior neck just above the jugular vein. In the image A, you can see that palpating the interior inferior neck just above the jugular notch by gently pressing the fingertips between the lateral tracheal wall and the medial portion of the sternomastoid muscle. Now, what is percussion? What is percussion? Percussion is first I will show the percussion point. These are the percussion points in the neck, on the chest, and below the ribs and above the ribs. What is percussion? Press the distal of the pharynx to the middle firmly on the areas to be percussed and raise the second and the fourth fingers of the chest surfaces. The percuss the fourth lateral anterior and the chest wall is a manner access to the fingers is roughly parallel to the ribs and compared together. Being percussion superiorly and extend inferiorly to identify the level of the diaphragm quietly. Note the position of the diaphragm and ask the patient to inhale fully and hold the breath. Continue to percuss inferiorly and develop the new level of diaphragm. You will notice this is the whole procedure of percussion. Now it comes to the escalation. Escalation of is a here's the escalation diagram. It is also written above, but I will explain through the diagram. Escalation just is performed in a quiet room with a patient sitting or standing. First, you will when the thorax examined, the patient arm should be crossed. Okay, to the scapula laterally as much escalation can be performed during the tidal ventilation, deep forceful inspiration or exhalation. You will hear the sound of lub, blub, blub, and dub, dub. The greater the flow, all other things become equal. And listen for the 2 heart cycles. There, it will include the escalation of the lungs. Thank you so much.